I'm Dr. Dave Janda. Welcome back to the Insider Insight Show. I'm honored to have back with me someone who is a dear friend and someone who is a dear friend for every person of the world. Dr. Peter McCullough stepped up like no one else stepped up years ago when it came to what I've called and gotten in trouble for the freedom stripping virus. Maybe I should rename it the freedom stripping bioweapon. Pete stepped up from the very beginning, as did a small number of us, and say, hold on. We put our hands up and said, wait, let's look at the real facts, the truth, and the data. Pete has been targeted for his truth and honesty and courage in looking out for the health and welfare of every person of the world. Pete is an internist, a cardiologist, an epidemiologist. He's based in the great Dallas, Texas. He practices both internal medicine, including the management of common infectious diseases, as well as the cardiovascular complications of both the viral infection and the injuries developed after the COVID-19 vaccine. Since the outset of the pandemic, Pete has been a leader in the medical response to this COVID-19 man-made disaster. Pete, welcome back.
Dave, it's great to be back on the program.
Okay, Pete, you and I are probably the two alumni of the University of Michigan right down the road from me that they just want to push off the most, right? But at the University of Michigan, Pete, we used to do these rapid-fire grand rounds. Okay, so let's hit it. Let's do kind of a rapid-fire grand round technique and show folks what goes on. So, Pete, number one issue we're going to hit on this rapid-fire is currently, state of the art. If somebody gets COVID, how do they treat it?
First thing they do is you ask a question, is this the first episode of COVID? Very important. Risk stratification first. If it's the first episode of COVID, even if it's one of the newer, milder strains, it could be more severe symptoms. Only about 3% of Americans, Dave, have not had it. Mm-hmm. Almost everybody has had it. If it is a second episode, it's going to be very mild. And, those may be elderly, multiple medical problems, we would, get into a more serious treatment approach. But most people, your age, my age, we're simply going to need virucidal nasal washes and sprays, iodine, xylitol, colloidal silver. The Gargles work fine, Scoper Listerine, but it needs to be done every 4 hours and immediately within the first hours of treatment. Don't wait until the sinuses are very clogged to try to do this. So start with the virucidal nasal sprays and washes. Then in the McCullough protocol, which is the most widely used protocol worldwide, we have what's called the OTC bundle, over-the-counter bundle. Mm-hmm. Zinc, vitamin D, vitamin C, quercetin, and over-the-counter famotidine, which is an antihistamine antiviral. Very important. So that is the main line treatment for a second or third episode of COVID. Very rarely do we need to get into the prescription drugs, which can include hydroxychloroquine, ivermectin, Paxlovid, molnupiravir. They're not needed. We can follow up for congestive sinusitis, azithromycin or doxycycline. I think everybody should take some aspirin because there is a heart attack stroke risk even with these subsequent episodes of COVID. So 81 milligrams for those who've had stomach problems, what have you. A young person like myself, I took 325, and we take it for 90 days afterwards. And then very rarely would we need to use blood thinners. Mm-hmm. So if I have a patient recently with a hip fracture, for instance, COVID, definitely I would use enoxaparin. We know the infection is very thrombogenic, Dave, so we have to be aware of that. So the pulmonary risks mm-hmm. of getting in trouble with modern day COVID, and the current strains are EG5 and FL 1.5. The pulmonary risks are very low, but there still are the cardiovascular and thrombotic risks of getting the infection.
If someone is pregnant and breastfeeding, they develop COVID, what would change in your protocol there? Anything?
No, they can still use all the same approaches. The virucidal nasal sprays and washes are fine. Do you know in pregnant women, we actually advise supplemental iodine, so it's not a big deal to swallow a little iodine. That certainly doesn't have any toxicity there. No, we would generally use the same approach. We know aspirin is safe in pregnancy. We know corticosteroids, I failed to mention, in pregnancy, inhaled budesonide, oral steroids. Hydroxychloroquine, there's actually been dedicated pregnancy studies, very safe. Ivermectin, we would not use Paxlovid or molnupiravir in pregnancy given theoretical mutagenesis.
Okay, Pete, let's address there are a significant number, unfortunately, of people who are either conned or coerced into taking the jab somewhere along the line. Let's talk detox programs now. Okay, many people say, "Okay, I got it. I made a mistake. This, I still got COVID 14 times. There's nothing I can do." Well, no, Pete, there is. Educate our audience about detox programs because you've been the pioneer in this.
We're 3 years into the vaccine program. Do you know that the Biden HHS long COVID programs invested $1 billion, Dave? $1 billion. Long COVID. They don't consider the vaccine causing long COVID, but we do know now a paper by Dixier and colleagues from Germany clearly shows the vaccines are causing long COVID in the majority of people after 2021. That the Biden administration, after $1 billion, has found nothing, not a single drug, not a single protocol, not even a single suggestion of what to do in this case. So what we've done in my office is we've innovated, we've applied our best scholarship, our treatment acumen, and we've tried a variety of things. And prescription drugs have a limited role depending on what the findings are. Hang on a second. Mm-hmm. And what we know is that the symptoms of long COVID and vaccine injury are related to the spike protein. The spike protein is stuck in the body after the infection, the S1 segment, and then after the vaccine, the S1 and the S2 segment, because the protein's held in the pre-fusion conformation. So the spike protein from the vaccine, you get way more of it, and it's way more dangerous to the body than the infection. The spike protein, Dave, is loaded in every organ now, found at autopsy. It's causing all the problems that we see, the cardiovascular, neurologic, immunologic. It's found in the blood clots, Dave. So the spike protein's there for a couple years. We can't get rid of it with our own enzymes because it's a man-made protein from the Wuhan Institute of Virology. That's where it all came from. 3 natural substances work that we've identified. One is nattokinase. Japanese discovered this 1,000 years ago. It's the breakdown product of soy by a bacteria, Bacillus subtilis natto. Nattokinase is a natural thrombolytic. It's a blood thinner. It actually dissolves the spike protein in cell lysate and intact cell models. Very data. Tanikawa and Obu get a lot of credit for this in Japan. Another family of enzymes derived from the stems of pineapple called bromelain. Bromelain dissolves the spike protein, different proteolytic cleavage sites. And then lastly, curcumin, derived from turmeric. Curcumin doesn't dissolve the spike protein, but it really reduces inflammation from the spike protein fragments. That even has prospective randomized trials in humans, Dave. So we have published a proposal that we detoxify with nattokinase 2,000 units twice a day, bromelain 500 milligrams once a day, and curcumin 500 milligrams twice a day for about 3 to 12 months. And these doses are low. We can actually increase the doses. And what we're finding in our practice is, 3, 6, 12 months, patients are getting better, Dave. There's no doubt about it. We have case report forms. We're doing all the unfunded research we can. But with the 3 years into this, and $1 billion of U.S. money and no answers, we took measures into our own hands.
So, Pete, in spite of what you just spoke about the deleterious effect of that man-made spike protein that was incorporated in the jab, in spite of all that, of all the issues, of all the problems that have been well outlined and documented and published, on October 2nd, 2023, the Nobel Prize Committee awarded Carrico and Weissman for their invention of the mRNA platform that is the foundation of the jab. And this is what they received the Nobel Prize in Medicine for. Well, in fact, Carrico and Weissman, tell me if I'm wrong, Pete, got the Nobel Prize for not inventing the mRNA platform, but for adding an entity entitled pseudouridine, which allows unlimited spike toxins to be manufactured by the person's own body that's causing all these horrible ramifications, including millions of deaths around the world.